everybody, it's Dr. Joe, and today I'm going to show you some stretches and exercises for Plica syndrome. What? It's in the knee. So let's get started. Disclaimer alert, disclaimer alert. So basically the plica is an extension membrane of the joint capsule around the knee. And so it helps keep the knee lubricated, and when it gets irritated or inflamed, it causes a lot of pain in the knee on the inside, kind of right up in there. So the first thing we're going to start off with is just some stretches to kind of get everything loosened up in there. So start off with a strap if you've got a dog leash, that works, or a belt if you don't have anything like that, or you can even use a beach towel and just roll it up. But I like anything that has a little loop to it, because then you can just wrap it around your foot. So we're going to do an IT band stretch first, just to kind of loosen up the outside to help take some pressure off the inside. So with an IT band stretch, you can do a whole bunch of different ways, but the strap for me is usually the easiest. So you're just going to lie down on the ground, and you want to keep your leg nice and straight, but use the strap to bring it up, but try not to bend the knee when you're coming up. So you're just going to bring it up almost like you're doing a hamstring stretch, but you're not going to come up quite as high. And then as soon as you feel a little bit of tension, then you're going to drop it across your body, and you should feel it on the outside of your leg. You might feel it down at the knee, you might feel it up at the hip. That's kind of where that whole IT band is. So you're going to hold this stretch for 30 seconds and then come back down and do that a total of 3 times. Sometimes people can't go quite that high, but as long as you can cross it over, you should be able to feel a stretch. But if if this stretch doesn't work for you, I've got a video that has a whole bunch of different stretches for the IT band. So if this one doesn't work, go ahead and check out the others, because something might work a little bit better for you. So the next one is just going to be kind of to stretch out the knee. A lot of times if the plica is pinched or irritated, if it was this knee, people wouldn't have that full straightening or that knee extension, and you really want to get that, because if your knee gets stuck in this position, the hamstrings get tight and you just end up having a lot of problems. So just a simple knee prop is what we call it, works best. If you have something like a pool noodle or a regular foam roller, or even just a big towel that you can roll it up, prop your foot up so your heel isn't touching. And what that does is that gives some space here to allow my knee just to kind of hang down. Some people like to sit in a chair and prop their foot up on something else, which is fine. You can also, if you don't feel like you're getting enough stretch here, but most likely if you're irritated, you're going to feel a lot of stretch. But if you need a little bit more, you can just lay a little ankle weight on top, but make sure you don't put it on the knee. Put it up above the thigh. You can also just take a grocery bag, a plastic grocery bag, and put your foot through it and then pull it up here and just put some soup cans or vegetable cans in there. So that's a good way just to kind of let the leg hang and get it straightened out. So again, if you've got that little bit of a bend, just try and relax it and let it straighten all the way out. So with this one, it's not necessarily a stretch where you would just hold it for 30 seconds. This would be one, if you can tolerate it, you want to have it there for 5 or 10 minutes. So this could be something you just do in front of the TV, or if you're working on your computer, just prop it up so you don't have to just sit there and think about it, because again, sometimes it's pretty uncomfortable. So after you do that for a couple minutes, you'll probably just want to shake it out a little bit and relax it, and then that can take you into the next stretch / exercise, which is a heel slide. So with the heel slides, it's pretty much like it sounds. I like to prop up the other side just to give myself some support, but this time we want to work on bending the knee, because again, if that plica is irritated in there, or if it's pinched maybe in the joint somewhere, sometimes that joint doesn't move freely, especially with all that swelling around the capsule. So you really want to just keep it moving to help get that inflammation out of there. So just kind of like it sounds, you're going to slide your heel up towards you. So just kind of sliding it up this way, using the floor to kind of help the leg, and then just slide back down. So again, if you've got a lot of swelling in that knee, you might only be able to slide to about right there, and that's fine. Just go till you feel a lot of tension, not necessarily a lot of pain. Maybe a little bit of pain is okay. Hold it for about 3 to 5 seconds, and then just slide it back down. So you want to do this probably about 10 times just to start off with. But if it starts getting super achy around 5 or 6, don't feel like you have to push all the way through it. Just go until you're like, okay, that's enough. If I did one more, it would probably be painful. And then eventually you can work your way up from there if it gets easier. So after you kind of get everything stretched out and loosened up a little bit, then you want to strengthen those muscles. So now we're going to just do a 4-way hip, which helps those knee muscles because they're all kind of connected here. So even though it's called a 4-way hip exercise, it's working those muscles as well to help keep that knee strong and work that inflammation out of there. So the first one's just going to be a straight leg raise. So for the straight leg raise, you probably want to keep this leg propped up. One, it takes some pressure off of your back. If you have it straight out, it makes you have a little arch in your back. And if you have some back issues, that might cause some pain. So I always tell people just to prop up their knee, and it also gives you a little bit of a target. With a straight leg raise, you don't want to swing your leg up really high. You want to just go a slow, controlled motion so you're working those muscles. So the goal is to keep the leg straight, hence that's what it's called. So if you pull your toes up towards you, that helps lock out your leg. It activates the calf muscles and it activates the quad muscles to keep that knee nice and straight. Slowly just bring it up about level to the other side. So again, you don't want to come all the way up because then you're just going to use momentum, but just to about the other side, and then slowly come back down. So don't let gravity just drop it down, because one, that's going to be a little painful when you're dropping it down, and two, then you're missing out on that exercise of coming back down. If you can, if you feel strong enough, try not to bring the leg all the way down. So you're going to come up, slowly come down right before you touch the floor, and then come back up. So you're keeping those muscles activated and engaged the whole time. If you have to come down and take a little break and reset in between, that's fine. But again, with all of these, I just start off with about 10. If you feel okay the next day, do 2 sets of 10, 2 sets of 15. If you get to 2 or 3 sets of 20, 25 and it's easy, then you can add a little ankle weight and then kind of start back over with the 10. So then you're going to roll over onto your side, and this time it's going to be a hip adduction, AD. So this leg is going to now come up, working those inner muscles that have a lot to do with that area that might be painful. So these might be a little bit sore to do, so don't feel like you have to do a whole lot of these. You can either put your leg in the front this way or in the back, whichever one is more comfortable for you. But again, pull up your toes towards you and try and keep everything locked out, and then just lift it up a little bit off the floor. It doesn't have to be a big lift, but you just want to lift it enough where you feel that muscle activating. If you try and lift it too high, then you're going to start moving the rest of your body, and then that's going to be very uncomfortable. So again, just kind of lifting it, as long as you're keeping those muscles contracted and engaged, then that should be fine, just a little bit off of the floor. So then you're going to roll over onto your stomach, and you're going to do a leg extension. So I'm going to do my right side just so you can see it, but you would just keep the same leg going all the way around. So still keeping that leg straight and locked out, pulling those toes up towards you. If you have that a little bit of a back issue, make sure you're lying all the way down so you're nice and comfortable and you're not stressing something else out. But if you're comfortable propping up on your elbows, you can. Keeping, again, that leg nice and straight. With this one, again, it's not going to be very high, but try not to lift your whole hip up. So it's not this movement, because that's using my hip. You want to use those glutes and those hamstrings in the back. So you're just lifting it up this way. So it's not a big, huge movement, but you want to keep those muscles contracted and working the whole time. So, not just kind of flinging up like that, but really trying to lift up that whole leg without lifting your hips up. So again, same kind of thing, 10, 2 sets of 15, working your way up, adding a weight if you need to. So then you would keep on rolling around where now the injured side is up on top. So this is going to be hip abduction, AB. So with this one, you really want to try and keep your hips perpendicular to the floor. So not rolling your hips, but keeping them nice and straight up and down. You also want your whole body to be in a pretty straight line. So it's not going to be, when you come up with your leg, it's not coming up this way, but actually try and kick a little bit back behind you, because that's going to help keep everything straight. That's going to work those glutes, the medes, and the max in the back. And try and lead with your heel. So you're going up this way. If you go up with your toes up that way, then you're not working the muscles that you want to work. You're going to end up working your quads a little bit. So leading with the heel, going back a little bit behind you, trying to keep those hips fairly straight up and down. So same thing, working all those muscles all the way around. And then the last one is going to be a clamshell exercise. So for the clamshells, just kind of prop your knees on top of each other and your feet on top of each other. The same thing applies where you really want your hips to be perpendicular to the floor. This one's a lot easier to roll your hips back when you open up, but again, then you're not using the muscles that you're supposed to. So really try and keep them up and down. And if you need to lie all the way down again to keep everything else comfortable, make sure you do that. But as long as you're keeping everything up and down, you can prop up if that's comfortable. Your feet stay together for this one, and then you just lift that top knee up off the other one, again without rolling back. So it's just going to be this motion. It doesn't have to be high, because the higher people go, they want to tend to roll back like that. So with the clamshells, they seem pretty easy. The first 5 to 7, usually people are like, oh, that's fine. And as you get 8, 9, and 10, they get a little bit harder. So again, just start off with a little bit. If you get, to the 20, 25 with these and it's easy, you can add a little ankle weight around the thigh on top, which will give you some resistance. Or you can take a resistive band and wrap it around your legs, and then when you pull apart, that will give you some resistance as well. So those were your stretches and exercises for Plica syndrome of the knee. If you have any questions, leave them in the comment section. And I'd like to take a moment for the wall of thanks. So the people I would like to thank is Joan R., Ron J., Will R., and Steve A. Thank you so much. And if you would like to be on the wall of thanks, make sure and click on the link up here to find out how. And don't forget to subscribe by clicking down here. And remember, be safe. Don't hurt that plica. Have fun, and I hope you feel better soon.